Hello, and welcome to the Healthy Aging and Rehabilitation Program 3 Northeast. In this presentation, we will review some of the common questions people have when they come to the unit and the processes that make this unit unique. The patients on 3 Northeast have been identified by a physician who was or is caring for them, and as someone who would benefit from having therapy from the interdisciplinary team in order to improve their function and independence. One of our rehab physicians or geriatricians reviews and accepts the case for the program. Your name went on a wait list, and you were admitted when a bed became available. While you are on 3 Northeast, your day-to-day care is managed by your family physician or designate. But the physician who accepted you for our program is also involved with your care and makes suggestions for medical management. Each patient on 3 Northeast has a case coordinator assigned to them. This person is a contact person for the patient and or their families. They will share information when necessary from the team and direct you to the right person when you have questions that they may not be able to answer. You will meet your case coordinator in person, and they will leave a pamphlet on your bulletin board with their contact information, like the one pictured here. The routine of 3 Northeast is designed to get you moving and to participate in regular routine activities. Patients on 3 Northeast get up and out of bed in the morning, get dressed in regular clothes, go out to the dining room for meals, and participate in various activities throughout the day. Regular routine activities promote movement, endurance, and socialization that is required to get you back to routine life. Our visiting hours are Monday to Friday from 3 p.m. to 8 p.m. Visiting hours are limited on 3 Northeast in order for patients to be free to do their activities. It has been our experience that if visitors are present on the unit, it is difficult for patients to concentrate on their session, and it interferes with much needed rest periods. We realize that certain times of the year bring more friends and families from afar, and we are willing to look at special circumstances. Feel free to discuss this with your case coordinator or the nurse manager if this applies to you. There are some patients who are preparing for home, and their family or caregiver may be asked to come in to learn care techniques. There are many people that will be part of your interdisciplinary team, such as our team consists of physiotherapy. Physiotherapy helps with your mobility, improves strength, balance, and endurance. The goal of physiotherapy is to help you regain function and independence. Occupational therapy helps you improve your ability to do your daily routine activities. Recreational therapy helps you maintain your hobbies and complement your other therapies in a fun environment. Social work helps you and your family with social, emotional, and financial issues. Nursing staff consists of registered nurses and licensed practical nurses who will help you with your activities of daily living, support your independence, help you with medications, provide education, and provide treatments as necessary 24 hours a day. Nursing ward clerks greet visitors, answer phones, process doctor's orders, and coordinate appointments. Our pharmacist will help you by reviewing medications, educating you on what medications you are taking, and potential side effects. Good nutrition can increase your health and strength for rehabilitation. Our dietitian helps make sure that all of your nutritional needs are being met through healthy and balanced eating. You will receive a menu every afternoon, which will be picked up around supper time. Please make sure that you circle everything that you want to have for a meal, including condiments. Everyone has different dietary needs and abilities to swallow. Some people may be offered different choices than you. Speech-language pathology helps those who have swallowing issues and trouble with language related to a stroke or other neurological problems. Psychology helps those who are suffering from depression and other emotional issues. They also do assessments related to memory problems. Spiritual care offers spiritual care and support. If you wish to access this service, please ask your case coordinator or any other member of the team, and they will set this up for you. Housekeeping staff provide a clean and tidy environment. You will see volunteers during the recreation activities and/or other group activities. They work under the direction of the recreation therapist to work on your individual goals. We look after patients with stroke, amputations, people who have been ill or have had surgery and need to get back on their feet. Because our patients are in their own clothes every day, they may look like visitors. There are some who have memory issues and could get lost if they leave the unit. We have a locked door system in order to keep everyone safe. Please be cautious when you leave the unit and check with the nursing staff before you let anyone out. If you leave the unit to go for a walk or visit the cafeteria, please let your nurse know. If a specialist comes by to see you, we will go to get you if we know where you are. There is a cafeteria on the second floor, a coffee shop, gift shop on the first floor. We encourage you to have a change of scenery with your family if you are able and if you choose to do so. Some of your therapy will be one-on-one, while others will be in groups. Your appointments are posted on your schedule in yellow on your bulletin board in your room and on the scheduling board outside of the 3 Northeast dining room. You may have other unscheduled appointments that are added last minute. If you are in a room that for some reason you are not comfortable, please let the nurse manager know. We move people around on the unit for various reasons. It could be to receive a male or female patient. We prefer not to place male and female patients in the same room. It may be to allow for more independence in a room or make room for special equipment. Please understand that the room you are in now may not be your room for your entire stay. It is also wise to leave any valuables home, including money, special jewelry, or gifts. It is not uncommon for things to get knocked into the garbage can or taken out with the linen by mistake. The unit is not responsible for personal belongings. If you wish to have your hair cut or styled at the beauty shop or barber on the second floor and need money brought in, you can have your family bring money in and pay the hairstylist directly. Or if this is not possible, you could leave a check at the bedside. Please have the clerk schedule your hair appointments, as he or she has a better idea of your schedule and when it might be a more appropriate time. We often have family meetings to discuss patients' abilities and potential discharge needs. These meetings are with you, your family, the healthcare team working with you, and possibly your physician if they are able to attend. These meetings are booked by the clerk, who calls your next of kin, the person you have identified as your contact person, and it is the next of kin's responsibility to invite other family members or support people to come. Not everyone will have a family meeting, especially if you are able to do the things you did before you were admitted to the hospital, or if your family is small and the team feels confident that everyone is aware of the discharge plan. Since we all eat together in a common dining room, we tend to want to share food with others. We ask you that you do not share food with others, as there are many patients with swallowing issues, allergies, and other restrictions. Some patients may forget that they are on a restricted diet. Please check with the nurses before sharing any food with others. Especially if you see one of these signs posted at the head of their bed. There is a kitchenette on the unit, and you are welcome to anything that is not labeled with a specific patient's name. There is a fruit basket on top of the microwave. We encourage you to not keep fruit baskets at your bedside, as the fruit is often not all eaten before it starts to spoil. If you would like food brought in from home, you can use the fridge to store it, and ask the clerk to place a label on it. There is a cafeteria on the second floor, a coffee shop, and a gift shop on the first floor. There is also a beauty salon on the second floor. We encourage you to have a change of scenery with your family if you and your team feel you are able to do so. Passes to go out of hospital or home are something we encourage you to consider, depending on your abilities to get in and out of a car, get in and out of your home, and if you have someone to help you while you are out. When your team feels that you are ready for a pass, your case coordinator will discuss this with you and your family. If you are interested in a pass, please feel free to discuss this with your case coordinator. For some people, it may not be possible at this time to go out on a pass due to mobility or support. For those people, we can arrange a dial bus within the city limits to take you to the mall, a restaurant, etc., to be with family or friends. The therapist may be able to help you and your family to get into a car so you can leave the hospital to go for a drive. A pass is a great way to see how you make out in your own environment, and if you experience problems during your pass, your team can work on these issues prior to your discharge. Patients admitted to 3 Northeast get dressed every day. This tends to generate a lot of laundry. If you do your own laundry, you can use our laundry facilities. If you are not able, your family will be asked to take laundry home to wash. If this is not possible, families can use the laundry facilities. Nurses are here to look after the patients and are not able to do the laundry. The therapeutic team will continue to work with you until you reach certain goals. Many patients go home to continue working toward their goals and may be followed up by outpatients. When you come into the hospital for an appointment with a therapist or extramural therapist to see you in your home, if this is appropriate, you may require nursing home or special care home placement. If you are waiting for a nursing home placement, you will be moved to another unit in the hospital or transitional care unit 4 East in the hospital. Discharge planning is done by the team on the unit and not the discharge planning department. The social worker and nurse manager help patients and families to obtain financial assistance for services in home, special care home, nursing home placements, and medication coverage. If any of this is determined to be needed, they will walk you through the process and help provide you with the appropriate paperwork. We hope you enjoy your stay with us on 3 Northeast, and we wish you the best in your recovery. If you have any questions or issues you wish to discuss, please see your case coordinator and or the nurse manager.